Okay, seeing none, we'll move to 12A.
Department and committee reports, non-action items. Presentation on teen suicide prevention. Peggy Littleton, Commissioner, Board of County Commissioners, and Susan Whelan, Interim Director, El Paso County Public Health.
Okay, I'd like to invite our folks down. I know last week we had the opportunity to do a resolution for suicide prevention, and I had asked them quite some time ago to come over and just kind of follow up with that and give us some data and statistics on where we are, programs that have been implemented over the last couple of years, and how successful they have been, so that we can continue to move forward in this effort. So Susan, thanks so much for you and your team coming forward today. And I think you invited the sheriff and some other folks to be here as well, some law enforcement.
Good morning, Commissioners. Susan Whelan, Interim Director for El Paso County Public Health. As Commissioner Littleton has mentioned, we were here last week to recognize National Suicide Awareness Month, and we focused more on general populations. Today we are going to focus on youth suicide prevention. And we also have a short video as well to share. Youth suicide prevention is a priority in the county strategic plan under goal number 5, strategy 5, and mental health and substance abuse are the top 2 priority areas selected by the Healthy Community Collaborative for inclusion in the El Paso County's Community Health Improvement Plan. Reducing suicide among youth is a target outcome in the mental health and substance abuse dashboard. And I'm waiting on the Prezi, if that's coming on the screen. This is a dashboard that measurements, and this is how we're monitoring our efforts as it relates to suicide prevention. Youth suicide rates and circumstances are important data points that El Paso County Public Health monitors through the Child Fatality Review Team and shares with the community through this dashboard. In recent years, El Paso County has experienced high rates of youth suicide that outpace both the state and the national rates, which gives us concern. Between 2014 and 2015, we began to see a marked increase in suicide deaths among ages 10 through 19 years in El Paso County. This graph shows a similar increase for the state of Colorado, but as you can see, El Paso County's rate remained higher than the state, and the United States rate remained fairly level over time. The top five circumstances surrounding youth suicide fatalities are history of family discord, recent argument with parents, parental divorce, breakup with a girlfriend or a boyfriend, and drug or alcohol problems. Although Dr. Kelly is not able to be with us here today, the coroner's office is very important to this work. Some additional data that we have to share. There have been 2 youth suicides in the age group of 10 through 17 in the calendar year of 2018, and 2 in the past 11 months. It has been nearly 6 months since a teen has taken their life. For comparison, by this time last year, in 2017, we had lost 11 youth to suicide. And this is something I want to emphasize this next point. In the last 3 years, we have averaged 14 youth suicide deaths per year in El Paso County. Dr. Kelly stated if this number holds true, the 2 suicides in 2018, it is the fewest in the calendar year since his time in the coroner's office, which has been a decade. This is encouraging news and a trend, as we are so proud of this community's efforts, but we do not consider this a mission accomplished situation. Rather, we see this as evidence that we are responding to the crisis in a more effective manner and saving lives. We are moving out of the crisis mode and will continue to invest in our youth through the programs that the community and the team have developed and identified so young people are better equipped to weather the inevitable storms that they will face. As part of our efforts to align resources and build capacity, in 2016, a new priority area, bullying and suicide prevention, became available under Public Health's maternal and child health funding. Public Health assessed the feasibility to take on this work and approaches it from an upstream prevention and awareness standpoint that targets younger age groups, which focuses on starting conversations about promoting connectedness, resiliency, and life skills. In addition, the maternal child health work, Public Health secured Colorado State Innovation Model funding in 2016, which is a 3-year grant to support efforts to increase coordination of services for youth at risk for suicide. And in El Paso County, we have 17 school districts and a lot of area to cover. We also work to improve depression screenings and referrals for youth treatment among the school communities and youth-serving populations. In July 2016, Public Health began convening the Youth Suicide Prevention Work Group to make progress to strengthen the health and the well-being of the youth in El Paso County. At this time, I'd like to call up Megan Haynes and Kelsey Leva, who are health planners with El Paso County Public Health, and they have been leading efforts for the past couple of years with this youth suicide prevention effort.
Good morning, Commissioners. My name is Megan Haynes. I'm Teen Suicide Prevention Planner for El Paso County Public Health, and I have the distinct pleasure of talking about the collective efforts of the Youth Suicide Prevention Work Group. Youth suicide is complex and requires the community work together to address personal, family, and community factors that can lead to suicide. Given the size of and various needs across our community, one agency alone cannot tackle the issue. We needed to maximize our efforts by convening partners across sectors and across the community. We are truly stronger together. As Susan mentioned previously, El Paso County Public Health began a regular monthly convening of the Youth Suicide Prevention Work Group in July 2016. This has grown to include 60+ community partner agencies and 20+ community members and parents that have been involved in youth suicide prevention work in the community. Community partners involved in this effort include school districts, youth-serving organizations, community organizations focused on mental health, suicide prevention, and behavioral health, medical providers, law enforcement and fire departments, the faith-based community, county agencies such as the Coroner's Office and DHS, and suicide loss survivors. Over the course of the first 5 months of convening the work to identify not only the gaps and needs that existed around youth suicide prevention in our community, but also what had been working well and could be implemented community-wide. We utilized a lean process methodology to prioritize action items to work on within the work group. Assessing needs and gaps was a time-intensive but thoughtful and deliberate process that allowed us to begin to meet the needs of the community. Collective impact is a framework that really fits our collaborative approach to youth suicide prevention. Convening and mobilizing stakeholders for change is a key role of public health, and utilizing collective impact to guide our efforts has allowed us to work together more successfully and optimize our impact. After identifying the needs and gaps and prioritizing areas to take action, we recognized the need to break out the overall work group into topic-specific subgroups in April 2017. This would allow each group to more readily identify action items and make progress toward them. In fall 2017, it was determined that the work group needed additional structure to better support the subgroups, and we added a key leader board and a steering committee to assist with visioning and strategic planning for the work group. And now I'd like to turn it over to Kelsey Leva to discuss the results of our planning and some of our early successes.
Good morning. Thank you, Megan. So I'm going to start out by sharing about our community action plan developed by the Youth Suicide Prevention Work Group and the partners. This was a plan that really allowed our partners to share their expertise and knowledge on the issues to determine goals and due dates and how they'll measure their progress as a community. This is a plan. The plan is a tool that really allows us to take this work from sort of that crisis response mode into more thoughtful collaboration and upstream effort. We also have a data dashboard that we've been working on, and one of the hallmarks of collective impact is having a common data agenda among community partners. So we are working on this dashboard to support the work group. Much like our partners at Healthy Community Collaborative, this tool will help us visualize our progress as a community and provide accountability among the partners who are involved in this work. Even through the development of the work group structure and the community action plan, we've seen a number of early successes with the work group, and we want to recognize those with you today. First of all, we have a core of 30 to 40 partners who devote their time and energy to meet monthly and invest their resources and expertise in the Youth Suicide Prevention Work Group. These people come every month and participate in our work, and they're wonderful. We also you guys heard a lot last week about the co-responder model expansion effort in El Paso County, and this is work that was initiated by the Youth Suicide Prevention Work Group. We identified this through the gaps and needs process that we went through and recognized that there was an existing model for responding to behavioral health crisis in our community that could be expanded, and that work really started with the Youth Suicide Prevention Work Group and continued to involve our partners in the Sheriff's Office. We also leverage resources. These last few years, we aggressively sought funding opportunities and provided technical assistance to increase resources among our community partners. You can see the fruit of our labors in the El Paso County Public Health Walking the Talk of Collaboration handout in your packets. In a few minutes, one of our community partners will also come up and share an example of this kind of partnership. We advocated for critical research on the issue of teen suicide in El Paso County. We secured funding first for teen think tanks, during which we partnered with Pikes Peak Suicide Prevention to hear from 150 local teens about suicide and their perspectives. Second, we secured funding for ourselves and 3 other Colorado counties that have been impacted by youth suicide through the Community Conversations to Inform Youth Suicide Prevention Project. This study included focus groups of local teens, parents, school professionals, and community members. We educated local, state, and national partners in the media on responsible communication around suicide, which is an important part of addressing suicide contagion. We also provided in-person trainings for public information officers on responsible communication about suicide. There are numerous other successes that are difficult to quantify from this kind of work, such as increased cooperation, communication, and trust among agencies that support young people in these times. All of these successes are due to collaboration and part of the work group's efforts. At this time, I'd like to share a video that we created in partnership with El Paso County's Public Information Office. The video provides an overview of the reasons for forming the work group, the benefits of participating, and the hope for our future efforts as a collaborative in the voices of our partners.
We noticed beginning in 2015 that we had a sudden and dramatic increase in our youth suicides. That trend continued throughout the rest of 2015 into 16 and 17. But very early in that increase, we realized that we had a problem, that this was a deviation from what we typically see in this community. And because we were following that, it allowed us to reach out to the people that we needed to try to figure out what we were going to do about it.
In El Paso County, we have 8 towns and cities. We have 17 school districts. And so one agency cannot work on an issue alone. So when we have issues such as teen suicide, and we really want to promote the health and well-being of all youth in El Paso County, it's important that multi-sectors come together and work on the issue. It seems like we were receiving numerous concerning reports, And as a parent and as a public health professional, this is unlike any topic that I've been involved in. There's not an A to Z plan that you implement this plan and you're going to receive a zero suicide outcome. We've come together to make a difference and to make progress, and I think that's what we've shown over this past few years. We brought community leaders together from law enforcement, from behavioral health, from school communities, really community-wide, and got together and talked about the issues.
With this partnership bringing us all together, we are realizing strengths that have always been there for us for the most part that we haven't tapped into. And because of this work group, we do come together and network and are able to tap into those areas of expertise that make us a more efficient team to address teen suicide.
When a group comes together and really identifies where are the gaps in the community, where are the needs in the community, and then how can we work together collectively to address those.
When you start doing things alone, you leave out certain groups or organizations that have the resources and knowledge that could be brought to the table to support. And I think what this has done for us is provide a networking opportunity to come together and say, here are our ideas, here are the struggles that we're facing, and how can we come together and find a solution?
I feel like through these collaborations, the schools have learned more about us. The other resources in town have learned more about us, and so we're able to help our community a little bit more with that.
Youth Mental Health First Aid is a program that's well recognized by, in particular, the school districts, but other parts of the mental health community. And so what we're hoping is that this then also gives the faith-based communities a vocabulary and a connection with the broader mental health community in El Paso County.
Future success for me would be, we've gotten through the crisis stage, the crisis management stage. Now is the time that we reinvest in the youth and we start looking at some of those upstream things that'll help build resiliency in our kids, so that if we have a period of struggle again, these youth are better equipped to deal with those things, so we don't have to go through what we saw the last 3 years. I think for me, many of the upstream things are starting even with very young kids that we don't even think are kids that are at risk of suicide, and building up with those kids the ability to understand failure, to deal with stress, to deal with disappointment, because all of us are going to have those. We're all going to fail at times in our lives. We're all going to struggle. But the better equipped we are to deal with those periods, to have support systems in place, we can weather those storms. We can see the light on the other side and make it through.
If there's just some way that we can all boats can rise with the tide, and these kids, I may sound corny, but these kids know we love them, right? That we're on their team, we're on their side, that we're working together on their behalf. Again, I mean it's not too corny, but it's true. If we can spread and raise that awareness, even in the smallest degree, I'll be thrilled.
I think one thing that is extremely important is to thank our county leadership, our Board of County Commissioners, as well as our Board of Health, and all of the work group members that have demonstrated their support for addressing community issues such as teen suicide.
Everybody can always evolve and improve on what we do. And if that end result, that big picture, is saving lives and keeping some of these young people from taking their own lives all day long, we'll do that.
As I mentioned earlier, we also asked one of our community partners to join us today to share about their experience collaborating in the Youth Suicide Prevention Work Group and partnering directly with El Paso County Public Health to impact youth suicide prevention. I'm happy to hand it off to Becky Allen, Executive Director for Learning Services at Academy School District 20.
Good morning. It's truly an honor to be asked to come and speak today, and I cannot overstate the value of the partnership that I have, myself and District 20 has had with El Paso County Public Health. We absolutely experienced a crisis in our school district, and we have put such focus into, how do we help our students to best attain success? We absolutely have a commitment to math and science and social studies, but we know that as important and valuable as that work is, it pales in comparison to mental health and resilience and the wellness of our students. Because of the partnerships that we've had, we've been able to be a part of this suicide prevention work group, and it would take me a half hour to list all of the partners that we've been able to forge a relationship with. Just some examples: the other school districts, the faith-based community, law enforcement, NAMI, Susan Payne with Safe to Tell, all of those pieces. And through those partnerships, we not only learn about areas that we want to pursue to help our students, but we also learn about opportunities for resources that we can access. El Paso County Public Health was very gracious. They allowed me to work with one of their grant writers so that we could formulate grants to be able to access the resources to do the important work that we know that we needed to engage in. Just as some examples, Colorado Springs Health Foundation, El Paso County Sheriff's Office, the police chief at Colorado Springs, the state level Office of Suicide Prevention, the Colorado Attorney General's Office. These are just some examples of the partnerships we've been able to forge, starting with El Paso County Public Health to help us do this important work. Just as Dr. Kelly mentioned in the video, we have taken a two-pronged approach at District 20. First of all, how do we help students who are in a crisis? And just this summer in June, we had 23 of our staff members get trained and certified as youth mental health first aid trainers. What that means, you hear the word first aid. It's just like if I have a broken arm, you're not the physician to fix it, but you know how to get me the help that you need. You know how to recognize that I have an issue and how to keep me safe and get me health. Well, that's what we have now for youth mental health first aid, and we'll have over 500 of our staff members engage in that training this year. It's a day-long training, and we'll continue that work for years to come to try to empower our staff to have that skill set. And then, as Dr. Kelly mentioned, we've put a huge focus in the upstream work. As he said, we know there are going to be difficulties, challenges, those are inevitable. But how do we prepare our students to be able to face those? Few of the things that we're doing, again, that we were supported in large part by many of these organizations, we have something called Ruler, and that's something that we work on with our students pre-kindergarten through 12th grade, and it's all out of the Yale Emotional Intelligence Center. And it's about how do we teach our kids to recognize their emotions, to understand them, label them, and then regulate them. Also very proud, we're doing Riding the Waves curriculum at K-5. It's out of Washington State. It's part of their youth suicide program, but it talks with students about how do you build resilience? How do you know we're gonna have to ride the waves, ups, downs? How do you build resilience? What are the strategies? How do you ask for help? How do you belly laugh? How do you do all of those strategies that just help you be resilient in difficult times? And then finally, something we're very proud of as well, again, the partnership with El Paso County Public Health has been instrumental in our work with Sources of Strength, and Scott Lowe Murray, who heads up that organization. 6 of our high schools, 2 of our middle schools are implementing Sources of Strength. That is an upstream program where we have adult advisors and peer leaders come together to really help students strengthen their protective factors, know who their trusted adults are, and where they can go when they need help. So I just cannot understate, again, my thanks to all of the partners I mentioned and to my friends in back of me, and that's who I would call them now. They're my friends at Colorado, or at El Paso County Public Health. I know that they're there for us and partners in this important work, so thank you so much.
At this time, I would like to ask the members of the Youth Suicide Prevention Work Group who are in attendance today to stand and be recognized. Thank you for your collaborative spirit and your contributions to the Youth Suicide Prevention Work Group. We extend our sincere gratitude for your investment in and passion for this important issue.
We also want to say thank you to the commissioners for supporting our efforts to address youth suicide prevention in El Paso County. We also want to thank county leadership for their support. We feel fortunate, Megan and I, to live in a community that supports public health work and values youth health and well-being. I expect that you'll see us back next year talking about all of the great successes we've had working with the community on this issue. Thank you.
Commissioner Littleton.
Did you have anything you were going to close up? Okay. Well, I want to thank all of you personally as well. I know you guys put a lot of effort and time and energy into this and a lot of thought and emotion. As the vice chair for the TCA, the Classical Academy Board, I know that our Classical Academy has worked closely with Becky, and some of our staff have gone through a lot of training. I think it was really one of the things that we did last year is I don't want to say required, but strongly suggested that parents read a book called The Gift of Failure. It's by Jessica Leahy. And what it is it's really helping, the best parents learn how to let go so that their children can succeed. Learning that it's okay to not get a ribbon every time that you do something. Learning that it's okay, to say I'm going to be a good sport and somebody else won this game, somebody else won the race. And so it's really critical because I think there's been such a push in our nation and in our communities to be first, to be best, and it's okay to come in second. It's okay to not win it all and get a ribbon or a trophy, but to just say I did my best. And really encouraging those parents to kind of let go. We have a lot of highly successful parents in our community. We're a very highly educated community. And for them to say, it's okay for my kid to learn those difficult lessons about how to be team members, I think is really critical. So I strongly encourage that parents go read that book, The Gift of Failure. It's for the best parents that will really learn to let go and let their kids be kids and be successful that way. Thanks.
Commissioner Vanderwood.
Yes, thank you. I'd like to thank the team as well. And there's a couple of kind of observations that I've made. First of all, to the charts, there were some charts in there that I thought were really interesting because they spoke to specific actions that you planned on and, if you will, measures and metrics to measure your level of success in going forward. I'd say another one that's really interesting is the collaboration, which is great because it's school districts, it's El Paso County offices, but it's also private nonprofits and just interested citizens. And it seems to me, at least for now, right, you've really turned the corner and you've got these numbers turned around and took something that was a developing crisis and got those numbers moving in the right direction again. But I'm sure you know that having done that, it looks like you've got the right kind of programming and the right kind of activities that are needed to go forward, but the pressure will have to stay on. Otherwise, those trends will go back in the wrong direction again. And I was heartened to hear a couple of you mention, continued work in 18, coming back to the board in 19, and giving us output. That says to me you are committed to continue going forward, which I think is really, really important. So again, thanks to everybody for what you're doing, and just keep the pressure on, because without that, we'll probably see those numbers go back to where we don't want them to be. Thank you.
Absolutely. Anybody else? Well, great job to you and your team.
Thank you so much. And I wanted to emphasize we couldn't do what we do without Commissioner support. And we are really grateful to that. And you're part of this effort. So thank you.
Okay. Great. Thank you. I am going to use my discretion and call item